We allow about an hour and a half for assessment. Prior to the assessment, we send all our clients a form which will give us some indications as to what level of problems we're going to expect. Somebody may have had a very sudden change in their hearing, and if so, then we can intervene by making a phone call and making sure they take the necessary steps rather than waiting for the appointment with us. Larry, what we're going to do today is test your hearing.
Right.
I will ask you some questions about why you've come today, and we're just checking your hearing. So we'll just go through your past medical history and some various other important things in terms of hearing. And then what I'm going to do, I'm going to examine your ears with the fibre optic camera. We'll just examine and make sure that you haven't got a wax build-up. And then I'm going to do a test which measures how your eardrums are functioning. It's what we call a tympanometry test. And I'll put a small dome into the entrance of the ear, and you'll feel a slight sense of pressure. And it's just going to tell me how well the eardrum is moving.
Oh, perfect.
We always make an effort for any family member to come along, because if you've got just, when I say just, I mean a sort of gentle high frequency change in hearing, there isn't necessarily a change in volume, in loudness. So it's difficult for the individual to perceive that their hearing has changed. But those around them very definitely notice the change, because they're always saying pardon. If they turn away, they can't hear. They can't hear a conversation from distance. They want the television much louder. They're missing the telephone ringing or the doorbell going. But because those things happen so slowly, it becomes part of their everyday life, and they don't necessarily think it's a problem with them.